everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Minocycline. Its brand name is Minocin. And before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. So minocycline is a semi-synthetic derivative of tetracycline. It is primarily bacteriostatic and works by inhibiting protein synthesis. It has a similar antimicrobial spectrum of activity against gram-positive and gram-negative organisms as other tetracyclines. In terms of indications for use, we sometimes see this antibiotic used in the treatment of acne or cholera. It can be used to treat gonorrhea when penicillin is contraindicated. It can be used as an adjunct therapy to treat periodontitis. Some infections of the skin or subcutaneous tissue can be treated with minocycline. Minocycline can treat some urinary tract infectious diseases. And it can also be used to treat some respiratory tract infections. Keep in mind that this list that I just provided is not an all-inclusive list, it's just some examples. Now, before somebody was to use minocycline, there is a contraindication that they must clear, which in this case would just be a hypersensitivity to minocycline or other tetracyclines or any other component of the product. And there's also some precautions and warnings that patients should be made aware of. Patients should be made aware that drug reactions with eosinophilia and systemic symptoms, also known as DRESS, has been reported. Medication should be stopped at the first sign of this occurring. Photosensitivity may occur with the use of minocycline, so especially during the summer months, patients should cover up and wear sunscreen. This medication should be avoided during periods of tooth development, so in the last half of pregnancy or during infancy, due to the possibility of tooth discoloration. Clostridium difficile associated diarrhea may occur with the use of antibiotics. And hepatotoxicity has been reported with the use of this medication, so patients who have hepatic impairment should use this medication cautiously. Some autoimmune syndromes, including drug-induced lupus-like syndrome, has been reported. And patients should be made aware that some serious hypersensitivity reactions, such as Stevens-Johnson syndrome, are a possibility with minocycline. Intracranial hypertension has been reported. Sometimes this can lead to vision loss. And some CNS effects such as lightheadedness or dizziness have also been reported with the use of minocycline. These would typically wear off after the drug is discontinued. And lastly, minocycline should be avoided during pregnancy, and both genders should avoid taking the medication when they're trying to conceive. Now, once somebody is cleared of the contraindication, made aware of the precautions and warnings, and they start to use minocycline, they can expect to receive their dose orally or intravenously. So if somebody is using this medication to treat acne, they would typically start off with 200 milligrams taken as one single dose, and then follow up with 100 milligrams every 12 hours. Alternatively, they can use 100 or 200 milligrams initially, and then take 50 milligrams 4 times daily. If somebody is using this medication to treat infections of the skin or subcutaneous tissue, they could also use 100 or 200 milligrams, this time orally or intravenously, and then use 100 milligrams every 12 hours. They would only use the IV formulation if the oral formulation is not tolerated, and they would also try to switch back to the oral from the IV as soon as possible. The maximum intravenous daily dose would be 400 milligrams. As with all medications, there are some side effects or adverse reactions that patients may experience while using minocycline, so I'll go over some of those here now. 9% of patients may experience dizziness, and up to 23% may experience a headache. 9% of patients may experience fatigue. Some more rare but serious side effects would be Clostridium difficile associated diarrhea, tooth discoloration, liver failure or hepatitis. We discussed the possibility of DRESS and also Stevens-Johnson syndrome. That's all we're going to talk about today with minocycline or Minocin. As always, I'm very thankful you took the time to go by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.